Another no-shave November is done, and there's a lot of clean faces out there again. But what about clean bills of health?
Yeah, as Fox 61's Tim Lammers reports, a lot has been done to promote men's health, but it's still very much a work in progress.
The Movember Foundation is trying to stop men from dying early from all sorts of causes all year long. And the fundraising seems to be going well. $60 million, they said they raised in 2016, and they're still counting this year's November totals. But really, there's also awareness, a huge part of it, getting men to take charge of their own health. So how are we doing on that front?
Hit or miss.
Hartford healthcare urologist Dr. Bieniek said progress is happening, but it's slow.
Has it caused a cultural shift? Not major cultural shifts, but there are movements to try and get men into the office more.
For all doctors, it can be a tough sell.
Guys just don't like to go see physicians. We're in an exam room right now. It's awkward. It's small. It's confined. There's an awkward table with paper on it.
But especially for a urologist trying to get men to open up for a private talk about their privates.
You know that there are gloves behind me. There could be fingers going places to do exams that aren't comfortable for you.
Bieniek said the reluctance is understandable, but still, come on.
It's often the wives or spouses or partners kind of twisting arms and saying, go see the doctor.
Once they've come in, Bieniek says he often breaks the ice by asking the awkward questions first. And many guys don't realize how important that conversation is. Bieniek says in some situations he can start to see a bigger problem that a primary care physician would have seen if a guy wasn't too stubborn to go there, too.
The one we tend to focus on is erectile dysfunction as a canary in the coal mine, as a silent marker of early cardiac disease, because the arteries in the penis are smaller and they're going to be affected by blood pressure and cholesterol problems and changes first. So if I see a man who hasn't seen a primary care physician, I am on them. You need to go see you need to get a family doctor, have your cholesterol and blood pressure checked.
Bieniek said the challenge going forward for providers is to remove as many barriers to treatment as they can to make it as easy as possible for men to help themselves.
Even creating men's health clinics, trying to create a program that is directed to men, that creates an environment where they're going to be more comfortable. It's a physical setting that they're going to enjoy, be able to come back to. And wouldn't it be easier if you could come see all of your doctors in one setting?
I'm Tim Lammers, Fox 61 News.